My name is Troy Ouska, and I'm a registered nurse here at the Oregon State Hospital. I take care of 26 patients on our unit. I work Monday through Friday from 6:30 to 3. I have multiple disciplines that I do every single day, whether it's having meetings with doctors, with psychiatrists, whether it's engaging patients in conversation. I try to diffuse situations if there's aggressive behaviors through talking, communicating. Basically, I try to engage with patients as much as I can. On the whole unit, we also have, besides the 10 to 11 floor staff is what we call them, the registered nurses, CNAs, LPNs, we also have 2 psychiatrists. We have a psychologist. We have 2 social workers. We have a nurse manager, and we have a nurse supervisor. So there is an entire team that works together. We call them the IDT, the Interdisciplinary Team, which is made up of the social worker, the psychiatrist, the psychologist. We have a treatment care plan specialist, who's also part of this IDT team, who works and produces individualized treatment care plans for our patients, which, for example, will include that they will be medication compliant. They will participate in activities on the unit. They will have display safe behaviors. They will, if they're underweight, they will be encouraged to eat more food. Also part of this whole interdisciplinary team are county officials who will help work with placing our patients back into the counties that they're from. Very collaborative. Yes. The whole team is a very collaborative process, and we all have input and we all have say. We will work together. We meet with our patients when they first get admitted within 3 days with this entire team. After the 3 days, we meet with them again within 10 days. And after that, it's every 30 days until they are discharged from this hospital. We don't do a lot of medical procedures. If our patients come up to us and tell us they have an ear infection or their ear is bothering them or they have a headache, we assess them, we look at them, and then we refer them to our doctor. So we're not doing a lot of medical treatments on our unit, but we're doing more of just engaging our patients, making sure our patients feel safe every day, making sure that their needs are met, and making sure that they're thriving and they're progressing in their treatment and to get discharged out of this hospital. Well, I think the most personal quality that a person needs to possess in this career, in this field, especially in registered nursing at the Oregon State Hospital, is to be empathetic. I believe that is the biggest thing. I try to put myself in our patient's shoes every single day, and not just putting myself in their shoes, but looking at the patient as, what if this was my mother, and what if this was my father? This was my brother or sister. How would I want them to be treated while they're at the hospital? How do I want them to be cared for? That's how I look at my day every single day, and that's how I interact with every single patient every single day. It leads me to have a better relationship with our patients. I had no idea this psychiatric nursing existed 4 years ago. I happened to fall into it, I happened to love it, and everything I knew about a mental hospital was completely wiped away. We have more therapies at this hospital than I can imagine. We have more groups than I can ever imagine. We get patients out on passes, on the weekends and the weekdays in our community, engaging with people out on the streets. You get to do things here as a nurse that you would never get to do in any other nurse settings. I get to take patients to Silver Creek Falls and go on hikes. I can take patients down to coffee shops at Starbucks and sit there for an hour and drink coffee with them. It's a completely different style of nursing. At the same time, it's very rewarding and beneficial too.